So good afternoon, our friends, our media partners. We are very glad that you are all here today. I'm Lizelle Husayan from the Department of Health Media Relations. And here with us today is Undersecretary Kenneth Hartigan-Go from the Department of Health. And we also have with us Professor Peter Sheehan, the Research Director from the Victoria Institute of Strategic Economic Studies from Australia. Okay, so just a little house rules before we start. Um, our proceedings would be the Undersecretary would read our official statement, an additional statement from the professor, and then after that, we will proceed with our questions. As we go with our questions, may I remind that you introduce yourself and the agency that you represent. Thank you. So, sir?
Good afternoon, ladies and gentlemen. Thank you for joining us on this press conference. I'll read a statement from our department, and because we are a close partner with pushing some of the health-related agenda in the APEC meeting. And our theme is let's promote good health and sustain economic development. The Philippines, through the Department of Health, called on member economies of the Asia-Pacific Economic Cooperation to promote good health in order to stimulate and sustain economic and social development. The APEC 2015 theme, Building Inclusive Economies, Building a Better World, underscores the significance of promotion of economic cooperation and advancements of inclusive growth in Asia-Pacific region to attain productivity and enhance the quality of life of population across the region. The Philippines identified 4 priority areas in drafting the roadmap for free trade area of Asia Pacific. These are, number 1, enhancing regional integration. Number 2, mainstreaming small and medium enterprises in the global and regional markets. Number 3, investing in human capital development. And number 4, building sustainable and resilient economies. In this regard, APEC recognizes the changing landscape of global health challenges and the double burden of disease resulting from economic and health trends across the region. Good health allows citizens to reach their full productive potential, and the innovations that drive good health provides an outstanding economic return. And this is what our Health Secretary, Janet Loreto Garin, has emphasized. Now, in the meetings that we have 2 of this meeting, the Health Working Group and the Life Science Innovation Forum. Both the Health Working Group and the LSIF, as we call it, discussed the results of new initiatives and provided recommendations in preparations for the APEC leaders meeting this coming November. The 4 key priority areas are Roadmap for the Healthy Asia Pacific 2020 Initiative, which covers critical success factors and immediate actions to ensure the initiative is implemented in a meaningful, sustainable, cost-effective manner and mitigating the threats to the region's people, trade, and economic security. Second, the need to address continuous rise of infectious diseases and antimicrobial resistance, especially those acquired in healthcare and institutional setting like hospitals. Initiating promotion of both physical and mental well-being is very important, and particularly addressing the increase of chronic diseases, and this includes hypertension, obesity, diabetes, in promoting mental health by reducing its stigma. And lastly, emphasizing the fiscal implication of ill health, reiterating that as more people are forced to retire early because they're ill, economy will be affected adversely because we become less productive. Moreover, policymakers, experts, stakeholders from among the 21 economies convened last August 24, and we finalized the policy toolkit, which will be a checklist of recommendations that will assist government, companies, non-governmental organizations in improving health-related barriers to women's ability to enter and remain and rise in the labor force. This toolkit, by the way, will be launched on the 16th of September in Manila at the Women and Economy Summit. Now, women empowerment and the promotion of gender equality are keys to achieving sustainable economic development in APEC. Millions of women in Asia-Pacific region have the potential to contribute more fully to their economies. Higher rates of women labor force participation would also counter some problems like shrinking labor pool due to variable birth rates and a rapidly aging population. In some economies, they have this problem. These are facts that need strengthened policies in order to collect best practices. Now, this is where APEC can significantly contribute, according to Secretary Garin. Prior to high-level meeting, the APEC recognized the Philippines with an APEC Lighthouse Award. And this award is for business ethics, because of our collective contribution to the country's government, private business sector, and civil society in developing and implementing guidance on ethical business practices covering biopharmaceutical, devices as it relates to health professionals. This is in a way to level the playing field to assist small, medium enterprise. APEC provides a unique platform for promotion of innovation in the health sector. This supports the broader trade and investment agenda. We hope to obtain a meaningful result from APEC platform of liberalization, facilitation, economic and technical cooperation, both for human and economic development, Secretary Garin further mentioned. So, that would like to thank you for listening to our press statement. Thank you.
Sir, would you have additional inputs regarding your statement?
Well, yes. Well, if you're curious what this Healthy Asia Pacific 2020 roadmap looks like, it covers 5 critical areas. The first one is that the government has to be open and committed to health using a whole of government approach. Secondly, we collectively should develop a platform to engage and listen to our different stakeholders for a meaningful policy dialogue. And the third one is not to forget that there is a prevention and control and awareness of diseases that has to be put on the table for prioritization. The fourth one is that innovations that are out there, and we should not be afraid to encourage, invest in it, and adopt it. Lastly, none of these things will work unless we have intersectoral cross-fora collaboration with other sectors that are discussing issues in the APEC meetings. So this is some of the principles we have guided us in developing this roadmap. It's a living document, by the way. No? It's still evolving. So, thank you.
Thank you so much, Undersecretary Hartigan-Go. Now we will have Director Sheehan for his statement.
Thank you very much. My name's Peter Sheehan and I'm from Australia. I'm co-chair of the Life Sciences Innovation Forum, one of the 2 organisations collaborating in the health area in APEC. The chair of the Life Sciences Innovation Forum is Secretary Garin from the Philippines. She has just taken on this role. And I have been co-chair since the LAS was founded in 2002. But we particularly welcome the input that we've had from the Philippines over the years and the willingness of the Secretary of Health in the Philippines to take the chair's role, and already her leadership is active. Lots of things and lots of jargon we can talk about, but I might just highlight 2 points about what we're about. Firstly, our work is about innovation, which just means ideas or processes that are new to the context in which they're applied. They don't have to be new discoveries in a global sense. I mean, I often remark that the US in recent times is trying to be innovative by introducing further elements of universal health care, which many countries have done a long while ago. So the emphasis is on innovation and how we can introduce better innovations, product, processes, systems, how we go about doing it. And the second point I wanted to emphasise, which has been an important part of our work, is what Secretary Garin mentions in the press statement, namely economists are really just starting to realise how important health is for economic development and welfare, for productivity and so forth. and for poverty alleviation. So we are moving towards a much broader understanding that health is just not one of 50 things that governments must address, but it's critical to the wealth and indeed the economic development of the nation. So in the meetings here and elsewhere, there are many different issues being looked at and developed. Women's health, as my colleague Ken has mentioned, and the press statement is a really important issue that's being focused on. Mental health is an important issue in the Philippines, as in most other countries, and more generally what we call non-communicable diseases, strokes, heart attack, mental health, these diseases which are becoming more important in every country as countries age. So what we are trying to do in APEC, in the Life Sciences Forum and elsewhere, is to learn from one another, from the 21 economies can learn, and it is really remarkable how much we can learn from one another, and to operate as a tripartite process. When I say tripartite, I mean government, industry and academia. There are relatively few organisations anywhere that are tripartite and can bring the different skills together to solve and address problems in a different way. So at the meetings that are going on, there are many exciting developments in a range of areas. As I said at the beginning, we are particularly grateful for the involvement and leadership of the Philippines and Secretary Garin in this process. Thank you.
Thank you very much, Director Sheehan. Now the floor is open for questions regarding APEC. Please state your name and maybe the agency or the network that you are representing as we go with our questions. Thank you.
While you're thinking of your questions, I'd like to also say that if we all aspire for a sustainable economy, it stands to gain that we must have a healthy economy first. I think that's some of the things that are often neglected in the discussion, but we're here to find a balance between economy and health. And this afternoon, in fact, we are hosting the high-level meeting number 5, which specifically talks about health and economy and the cross-cutting issues of different fora together. You're welcome to join us this afternoon. It will be at the waterfront.
So any questions? Yes, sir.
Good afternoon. I'm King Perez of TV5. This question is addressed to Undersecretary Go. You mentioned in your in the 5 critical areas for the 2020 roadmap about this diseases that should be prioritized. So what are these particular diseases, sir, that would be prioritized for that particular initiative, sir?
Right. Well, the non-communicable disease priorities will be on obesity and hypertension, things that are top in the rank of mortality, morbidity, because if we significantly cut them down, it will then redound to a better, healthy population. And that will cut the cost of government expenditures as well as out-of-pocket expenditures of individuals. So that's the non-communicable side. You recall that earlier we also mentioned that we're putting in the agenda focus and priority also on mental health. Apparently, many institutions are not yet ready to accommodate the mental health problems, and this seems to be like a neglected, non-communicable disease. And because of this awareness, we're now getting institutions to be ready to deal with it a bit more responsibly. No? The other one is on infectious diseases. Now, globally, we're a bit alarmed with the incidences of antimicrobial resistance, and especially when you catch these infection in a place that you should not be getting them, like hospitals. The term there is nosocomial infection. We are also looking for cost-effective ways in the Life Science Innovation Forum to address and cut down on these infectious diseases that can be prevented. So these are some of the examples of the priority. It also depends on the member economies and what they believe are currently what they see with evidence, and the group comes together to help address it through learning from best practices of other economies and sharing their expertise.
Thank you. Okay, one more.
A follow-up question, Undersecretary. Are there already discussions pertaining to HIV, especially that in the Philippines there's a significant rise of such cases? Was it discussed already in the previous meetings?
Yes, in the previous meeting there has been some discussion HIV-related infections, and it continues to be top of our priority in minimizing it. The approach to HIV is not just on the treatment, but also in prevention, public education, and also in public health interventions. We are aware of the rising incidence, no? And part of that is the drug abuse, no? Through sharing of tainted needles, for instance. No? But thank you, that the question is quite significant and valid. Thank you.
Thank you so much. Do we have further questions? Yes, ma'am.
Hi, sir. I'm Ria Fernandez from PTV4. My question is addressed to you, Usec Go. Sir, how much do we economically lose with poor health condition, and what sex and age among the working group is most vulnerable to sickness?
Okay. To address the second question first, we believe that the women workforce is much affected if we don't engage in women's health. And that's one of the reasons why, and it's not just in the Philippines, it's just one of the reasons why we collectively came together, because it has been identified as a neglected issue. Women's health, in particular, we're addressing, and we're addressing it in 5 fronts. No? The first one is that health and safety of the workplace should look at also gender and the women's needs. No? Second one is that these women must have information and access to good quality health services. The third one has something to do with women in some economies may have disparity in accessing family planning and sexual and reproductive health services, and we made mention of that needs to be emphasized. The fourth one is not all economies have this kind of problem, but we do acknowledge that gender-based violence and harassment in the workplace, we need to provide them with a safer environment, is something that we put into the toolkit for healthy women. And lastly, the promotion and the principle of work-life balance for the women. Now, with regards to the economic loss of that I think is still a subject of a study being undertaken. So I don't have the numbers to share with you, but once the study is finished,
Okay, but previously we have researched that there is a correlation between productivity and health.
Yes.
Okay, thank you.
I believe that Asian Development Bank has done some preliminary studies. I don't have the figures though.
Do you want me to comment?
Yeah, please, Peter, if you know the numbers,
Okay.
help me. Help me.
Well, there are different numbers, but we did some work for LSIF last year, which is being built upon this year, and for the Philippines, as I recall them, we found that the cost of the incidence and projected future prevalence of non-communicable diseases was 5 to 6% of GDP in each year, which is, from our perspective, a large. This is just looking at what we call absenteeism and presenteeism, that is not being still formally employed but not being actually able to go to work, or going to work but being less than fully productive, and premature death. 5 to 6% of GDP, and that, as I recall, mental health was a very important contributor to that, and the burden of loss was greater for women than for men.
May I just repeat? GDP, global GDP.
No, this is for the Philippines.
For the Philippines, less 6% for non-communicable diseases and less 5 to 6% for mental diseases.
No, they're combined. Mental health is
Okay.
part of non-communicable diseases.
All right, thank you, sir.
Thank you.
Thank you so much, ma'am. Do we have other questions? Yes?
Hi, I'm Mads Miraflor of Manila Bulletin. I have two questions. For Usec Go, you mentioned about the innovations that we should do in the healthcare sector. Can you cite examples of innovations that are now in the pipeline? And just related to the previous question, you said that good health is significant to achieving full potential of the economy. How far or close are we to becoming resilient to poor health conditions?
Oh, you have a lot of questions. For well, okay. Some of the innovations I can share with you by way of an example is that the economy, the different member economy have identified that, say, supply chain of pharmaceutical drug is an important issue to tackle. And as you know, there are some issues of counterfeiting, fake drugs, and things going through the borders. And one of the activities we have undertaken is supply chain security or supply chain integrity. This is a work in progress, started a year ago, and we're putting in more efforts in training regulators, a law enforcement agency, customs, laboratory, to align ourselves to create a system for tracking, like traceability and tracking traceability of products, such as the adoption of a global data standards, so that there's an efficiency in tracking the products from a good source, how it is handled eventually, how it enters the borders into the country, how it is used to the retail. So this is an ongoing thing. The last 5 days, starting Monday, the 2 sessions were ongoing, dealing with this kind of issues. So that's the kind of innovation we have. The second one I can think of is that of a blood supply safety network. As you know, the blood supply quality and safety is quite variable in different countries and economies. And we thought that by harmonizing a standard for blood supply, blood, by the way, is considered a pharmaceutical product. So quality, getting people to donate blood, and how safekeeping, how do you cost efficiently utilize it by extracting the different components of the blood might be of service to people in need of the blood. It affects tourism, it affects migration, work, affects maternal death. It has an implication as well to disasters and resiliency, how the good blood supply, and this is tackled under the Life Science Innovation Forum. We also have a biomedical innovation center where it is led by academe and government, and to some extent industries involved in looking at inventions and discovery and how to translate it to commercialization so that the population in the region would have access to this kind of good innovations. Peter, do you have any more examples of life science innovation that you could share?
Well, I just think of one of the last presentations we had before we left and came here, which is about cervical cancer.
Oh yeah, sure.
Where there are lots of modern technologies developing, both in terms of vaccines and in terms of screening. And cervical cancer, as you know, is an important killer of women in 1 or 2 APEC countries, not the Philippines. It's more important than breast cancer. So the discussion and the sharing of information about both existing methods and their development. We have work going on in cervical cancer that is being led by the National Cancer Institute of the United States, with some cooperation from the leading cancer group in Beijing. So this is an example of the way knowledge can be shared of the best practices and best methods, and then taken up and applied by individual economies as they are able and as they think fit. But there are many other examples like that.
Just this morning, there was a presentation of the Health Science Academy, where University of Beijing, part of the life science project, is creating some training and center for excellence for regulators in order to harmonize the way we do things. And this, in a way, is intended to decrease regulatory barriers to trade, no? And people will then hopefully get better access to some of these innovative products.
Okay, thank you very much. We're entertaining only one question. Yes.
Good afternoon. I'm Reb Basilan from SunStar Cebu. This question is addressed to Usec, and Mr. Sheehan can also share as well. You mentioned earlier that ensuring mental health is among the priorities of under the roadmap. Can you tell us a picture of how bad the situation is in the Philippines when it comes to this area, ensuring mental health or addressing this problem? What efforts have been put in place to, for example, erase the stigma? That's it. Thank you.
Thank you for your question. Well, I must admit that this is only a starting point. To what extent that this is not assessed, we are currently doing what is known as a strategic needs assessment, not just in the Philippines, but across the different economy. Once we have the data, we'll be in a better position to give you the prevalence of the mental illness. But suffice for us to know is that from some of the initial findings, it looks like it's one of those neglected conditions. And being neglected, it's hardly being reported. Anxiety, harassment, work pressures, unable to deliver work productively affects our ability to have income. So that's the reason why we're doing it. I think one of the project in the innovation is developing what is known as a digital hub, so that we can share best practices. In some remote areas, we have examples where, well, we don't have enough mental health experts also as among the health professionals in far-flung areas. So we've also looked at best practices where the use of, say, digital technology like Skype might provide a specialist doctor, say, in an urban area, able to provide some advice to, say, to a general practitioner, so that they are able to then deal with that condition. Secondly, we are still looking at the supply chain to allow this kind of mental drugs or psychotropic drugs to be made available to areas and make the doctors feel confident in using these products in aid of the patients. Now, in reducing stigma, that's going to be quite a serious social marketing exercise, but it's in the pipeline as well. Peter, you have anything to share?
Ken, I might just say a couple of things, but I'm smart enough not to try to make any comments on the Philippines with the limited knowledge that I have. But I would pick up 2 points that have already been made. Well, I'd firstly say I think a very important development of the last 5 or 10 years around the world is the greater recognition of mental health as a serious issue, the greater recognition of the problems associated with the stigma and the suppression of mental health as a problem, and the associated issue of underreporting. All of these things go together in many economies to suppress or make the problem more difficult to deal with. Another thing that has been very important over a longer time frame, but is still important, is shifting from institutional care to care within the community of one sort or another. And you know, there's still many economies in which the response to serious problems of mental illness is institutionalization, which is both ineffective, costly, and degrading to the people involved. I think there is, and part of our work on mental health, which has been very valuable, is sharing experiences and practices about community care and how you do that. In Victoria, in Melbourne, where I came from, we were one of the leaders in doing that, but lots of problems remain. And there's also, as Ken mentioned, finding the right balance between drugs and psychosocial care and therapy. So this is really important work in progress, and this is happening in many ways, but I think APEC is one of several forums that is leading the economies of the APEC region to understand better the nature of this problem, the suppressed nature of the problem, and start to think about how we can do it better.
Thank you very much. We're now having the concluding statement from Usec Go and Director Sheehan.
Yeah,
I'd like to reiterate that in order to have inclusive growth and sustainable development, there is a need to invest in healthy communities. And this is one of the efforts that we're putting together. Healthy communities, empowering people, and using a whole of government and a whole of community approach is necessary. Thank you.
I would just conclude on 2 points. Firstly, recognition that health is critically important to the society's welfare and its development, and shouldn't be treated as just one more of many things that the government's got to try and find some attention to. And secondly, we at LSIF remain very grateful for the support of the Philippines and the involvement of Secretary Garin. Thank you.
Thank you very much. This ends our press conference for the APEC high-level meeting. Thank you very much for your continued support to the Philippines and the Department of Health.